In this video, we are going to tell you how to stimulate breast milk flow immediately after delivery. For most African moms, it is very difficult for their breast milk to come immediately after delivery. And we are going to be telling you some of the reasons why before telling you what you can do to solve that problem. Hello healthy moms, welcome to Inyango. Here we talk all things motherhood, from tips and tricks to hacks to personal experiences to make your motherhood journey a bit easy. Despite the numerous substitutes for breast milk out there, I would like to reinforce that breast milk is the best food for your baby, and it is crucial for newborn babies to be fed with breast milk, especially with the first breast milk known as colostrum before introducing formula or any other foods. Colostrum is a highly concentrated and nutrient-rich fluid that is produced by the mother's breast in the initial days after childbirth. It provides numerous benefits to the newborn baby's health and development. Colostrum is packed with essential antibodies and immune-boosting substances that protect the baby against infections and diseases. It also aids in the development of the baby's digestive system and helps establish a healthy gut flora. Additionally, colostrum promotes bonding between the mother and the baby, supports optimal growth, and sets the foundation for successful breastfeeding. Several factors can lead to potential delay in the flow of breast milk after giving birth. Here we are going to talk about some, and we hope this helps you and helps your breast milk to come in as fast as possible after you give birth. The first reason why your milk might be delayed is if you had a cesarean birth. If you had a cesarean birth, the hormonal response for breast milk production may be slightly delayed compared to someone who had a vaginal birth. However, initial breastfeeding as soon as possible after surgery can help stimulate breast milk production. Secondly, separation from the baby. If you and your baby are separated shortly after birth, either due to medical reasons or other circumstances, it can affect the initial stimulation of breast milk production. Early and frequent skin-to-skin contact and breastfeeding can help overcome this challenge. Thirdly, insufficient breastfeeding or pumping. If breastfeeding or breast pumping sessions are infrequent or not effectively removing breast milk as much as the breast milk is supposed to be removing, it can give a signal to the body that less milk is needed, leading to a delay in milk production or a reduction in the amount of milk that the breast produces. Establishing a regular breastfeeding routine and ensuring proper latch can effectively help breast milk to come out very well and stimulate more breast milk production. The fourth thing which can lead to delayed breast milk production can be hormonal imbalances or medical conditions. Certain hormonal imbalances or medical conditions such as polycystic ovarian syndrome, PCOS, thyroid disorders, or diabetes can affect breast milk production. If you suspect any of these underlying conditions, it is important for you to consult your healthcare provider, your doctor, for proper management and support. Now on to number 5. Number 5 is something which most mothers do not know: stress and anxiety. High levels of stress and anxiety or emotional distress can interfere with the release of hormones necessary for milk production. Creating a calm and supportive environment, seeking emotional support, and practicing relaxation techniques can help you mitigate these effects. So please do not stress yourself. If you're loving this video so far, please consider subscribing and putting on the notification bell so each time we upload a video, you'll be the first to know. And also consider sharing with your mom who might need this. Now, let's go on to number 6. For the next one, medications. Some medications, including certain birth control methods, can potentially impact milk supply. It's essential to consult your healthcare provider or lactation specialist before taking any medications while breastfeeding. Now that you know these points, please tell us in the comment section which one of them delayed your breast milk from coming in. And I would like you to remember that breast milk is a supply and demand process. The more frequently your baby breastfeeds or you pump milk, the more signal your body gets to produce more milk. If you experience a delay in your breast milk production or have concerns or other things which we might not be able to talk about here, you can write us on Inyango on our Facebook page and send us a message there, and we'll be able to give you individualized guidance and assistance. If you feel your situation is very, very complicated that we cannot help you from online, it's advisable for you to get a lactation consultant around you, and they might be able to help you. If you're still here thus far, you're such a darling. Let's go on to talk about the solutions. Since now we've identified the problems, I'll give you 8 things you can do to help your breast milk to come in time, so that you don't have to give your child maybe water and all the funny things which children are given because breast milk hasn't come in time. Let's get on to it. The first thing you can do, which is like the most important thing after your baby comes out, is for you to practice skin to skin contact. Unfortunately, for most of us in Africa, we don't get this in the first 30 minutes to 1 hour after we give birth, and that makes it difficult for our breast milk to come in. You have to hold your baby against your bare chest, allowing skin to skin contact. This helps stimulate the release of hormones that promote breast milk production. If you're going to birth, maybe you talk to your doctors to please give you the opportunity to do that to your baby immediately your baby comes out, and it's going to work like magic. The second thing you want to do is to breastfeed frequently. Begin breastfeeding your baby as soon as possible after delivery, within the first hour. Frequent and regular breastfeeding stimulates breast milk production. Like we said before, breast milk is a supply-demand process. The third, ensure a proper latch. Make sure your baby is latching onto your breast correctly. A good latch helps stimulate breast milk production and ensures effective breastfeeding. Seek assistance from a lactation consultant in your particular hospital or healthcare center, or get a healthcare provider who knows these things. We have a video on how to get a perfect latch, and if you're pregnant and you wish to learn more about this particular topic, search on our page and you're going to see about 3, 4, or 5 videos on breastfeeding. We understand how important breastfeeding is, and we also understand that breastfeeding is a skill that you and your baby are learning, and you need to get enough knowledge, as much knowledge as you can. Let's get on to number 4. For number 4, feed on demand. Respond to your baby's hunger cues and feed them whenever they show signs of hunger. This helps establish a healthy breastfeeding relationship and encourages breast milk supply. Number 5, avoid using artificial nipples or pacifiers. In the early days of breastfeeding, it is best to avoid introducing artificial nipples or pacifiers, as they can interfere with your baby's latch and hinder proper milk production. As difficult as it might be sometimes, please try to stick to you breastfeeding your baby such that you can get their hunger cues and feed them when they have to, and not put a pacifier or other things to feed your baby that might make them not to be as hungry as they're supposed to be and retard the way they suckle on your breast. The next thing that will help you is to stay hydrated and maintain a nutritious diet. Drink plenty of fluids to stay hydrated, as it is important for breast milk production. Additionally, consume a well-balanced diet rich in fruits, vegetables, whole grains, and proteins to support your overall health and milk production. Number 7, get plenty of rest and minimize stress. Rest is crucial for your body's recovery and breast milk production. Aim to get enough sleep and rest whenever possible. Minimizing stress levels can also positively impact breast milk supply, so try relaxation techniques such as deep breathing, meditation, and gentle exercise. It is important for you to rest. We know there is a lot for you to do, but prioritize rest so that you don't get to the level that you start becoming stressed because you haven't rested well. Now, on to number 8 and the last one. Seek support. Reach out to a lactation consultant, reach out to a mom who breastfed well, reach out to someone who can help you, because having these people around you can help so much with your difficulties with breastfeeding and your concerns. And remember, if you are struggling with breastfeeding, it doesn't make you a bad mom, because breastfeeding is a skill which you have to learn, and if you don't take out the time to learn, you might struggle with it. So if you have difficulties, find someone who can help and talk about it with them. We are sharing this video today because a mom got to us with the question and we thought to share a video on it. If you have more questions on breastfeeding, you can always reach us on our Facebook page at Inyango and drop us a message in our inbox or write us on WhatsApp, and we'll be so happy to hear from you and help you. Remember, every woman's breastfeeding journey is unique and it might take some time for your breast milk supply to fully be established. Patience, persistence, seeking support when needed can greatly assist you in this process. Remember, this is a learning process for both you and the child. So if you make mistakes, do not beat up yourself so much. Reach out to someone who can help. Reach out to us because we are ready and always here to help you. Let's keep raising healthy moms with healthy homes. See you here next week, same time, same place, and stay blessed.